If you're a primary care physician, you probably already know the initials DPC or direct primary care practice. If you're not familiar, direct primary care practice is a model where physicians can start up their own practice, and instead of having patients being billed by insurance, the patients join a membership where they pay a recurrent flat membership fee. And it's allowed many doctors to become their own boss, have greater control of their schedule, and get better control of their life. And today I'll be interviewing a direct primary care physician who started up her own practice, and this allowed her time to even go into other things that she wanted to do, including becoming a certified life coach. I think you're getting a lot out of this interview. My interview with Dr. Cynthia Villacis on this episode of Bootstrap MD. Hey guys, this is Dr. Mike Wu Ming. Welcome to another edition of Bootstrap MD. As you know, this is the podcast for physician entrepreneurs, and I love to spotlight doctors who are in the trenches, becoming their own boss. And I've got another one here, and I'm so glad she's on the program. She is a direct primary care physician as well as a life coach. She opened up her direct primary care practice about over 5 years ago after getting burnt out as an employed physician at a federally qualified health center, or FQHC. She then started her life coaching business about a year ago to help physicians who are stressed and want to make a change in their personal or professional lives, but feeling stuck. So I'm super excited to have her. She's one of our physician coaches on our physiciancoaches.com website, where you can find over 200 physician coaches that you can pick for in 12 different specialties. So I'd love to bring on the program here today, Dr. Cynthia Villacis. Cynthia, how are you doing today?
I am doing great. Thank you.
Well, thanks for coming on to the program. I was mentioning just prior to us coming onto the call, I know doctors who started up their own DPC practice, and they're super busy just trying to manage the business and doing all the things that we often don't think of when we were employed physicians. And then you decided, you know what, I want more stuff. I want more stress in my life. I want to take on more things. And I wanted to become a life coach as well. So I want to hear about your journey. We talked about it. We're probably graduated residency about the same time. We've had those turf wars. We've probably had some experiences. But I want to take about your journey from getting into medical school, then getting to residency, and then deciding to start up your own DPC.
Well, that's going back quite a ways. So I am 19 years out of residency. So going into, as far as the going into med school part, I was a little bit late in terms of coming to the decision that I wanted to be a doctor. So I graduated back in 1993 from Oberlin and stayed up there and worked a couple years, finishing up my prereqs, and then came down to Wright State in Dayton for med school. I was interested in doing primary care, and I had applied to and gotten into 2 med schools in the state of Ohio. And I had gotten married in undergrad, and the other school that I got into that was NEO-UCOM. I was one of 2 people who had been accepted, and I didn't want to be like the only married medical student. And Wright State had people coming from all different backgrounds, and had a focus in primary care. So that's how I ended up down at Wright State. And then I had my first child, followed my 4th year of med school. And I was looking at residencies out west. I made it out to Seattle with my husband and a 2-month-old. And we we were like, we love Seattle, but his family was in Ecuador. My mom was in Cincinnati. And we just decided that we wanted to be at a place where we'd have more support. And then as we went through med school, and I had my second kid at the end of residency, I had my second kid at the end of residency, we just decided to stick around the greater Cincinnati area. So, my kids would at least get to know one set of their grandparents. So that's how we ended up here. So actually on the other side of the river, I'm in Northern Kentucky. So
Family is important. And family is very important when we're deciding to raise. Yeah, for sure.
It is. It is. So kind of ended up coming back here and, figured we could always go to Seattle on vacation if we wanted to, but we didn't have to live out there. So,
so you went into residency, and this was a time too, was like, because I was in that same time, a lot of people say you got to go into primary care. Was a lot of your colleagues going into primary care at that time? Because now I think, it's definitely shifted. Everything now is about specialties, and primary care is often an afterthought, it sounds like, or at least I perceive it that way.
Well, there was, but Wright State was set up with a focus on primary care. So,
Right.
I remember helping organize like primary care day, and, we had a family practice interest group and stuff like that coming up. So, family practice was definitely recognized and encouraged. We had great mentoring as far as going towards primary care. And I remember doing some rotations as far as at some of the community health centers, up there with Dr. Gary Leroy at East Dayton Health Center, and just really got encouraged to go in that direction. So,
okay. So you've graduated, you completed your residency, and now you're looking at whole different job offers, I assume. Or did you have a set place in mind where you wanted to practice? And what was that for you?
Well, for me, I was wanting to stay in the greater Cincinnati area. At that point in time, I was pregnant with my second kid, and my husband was in school at Northern Kentucky. So we were wanting to stick around the area. And I ended up initially working at a hospital-owned group for a couple of years. Mm-hmm. And as a hospital-owned group, you don't really have much control over what's going on. And they ended up moving a physician into my office that had a problem with prescribing. And it was not a good match at all. Ended up leaving there. I did urgent care for a year. And then I started working in the community health center systems. I had gotten exposed to community health centers through medical school and really wanted to be able to try to help people from different backgrounds. And the community health centers have a way of having sliding scale for folks that don't have insurance, mm-hmm. and tend to have reduced fees for labs, and sometimes for medicines also. But they've got this weird thing where the way they get reimbursed by the government, they would get reimbursed like for the same amount for like a level 3 and a level 5. So you kind of, to have the thought that, it's a more complicated patient, so you should get more time with them, it doesn't really work very well. But I stayed in the community health center system for a number of years. I was at neighborhood healthcare for 3 years, and then I was with another community health center system in the greater Cincinnati area for like 8 or 9 years. And I love them.
Trying to see like which one kind of worked better, or what was the reason for
this? Why did I switch?
Yeah.
The CEO, to be honest, the CEO at the first place. I always wanted to provide quality care as far as to the patients. And she was more interested in how timely everything was, but didn't give me support to help make it more timely. My MA had to do the blood draws as well as room the patients. And it was a very dysfunctional system. There was one time where she came down and like knocked on my exam door and told me to hurry things up. This is a community health center system where people like literally would get off the bus, before their appointment and after their appointment. All of a sudden you'd have a waiting room full of patients, right? That was the way the system ran. You just kind of saw whoever was next. But yeah.
And I think she wasn't a physician.
No. Oh no, she was definitely not a physician. And what kind of made me move me towards leaving is when they were having financial problems. And I was trying to think through as far as what other things we could change, how I could change things. Once again, wanted to try to have some influence in how things happened. And the only answer she could come up with to give me about how things were going to get better is that I was going to see more patients. And I was already seeing.
That's usually the conclusion they come up with.
Yeah. Literally, I was like, how about this? Yeah. No, the only thing that she came up with is I would see more patients. I'm like, yeah, I can't do that. I'm already doing 10 to 15 minute visits on the patients. And yeah, that wasn't going to work. So I left from there and went to another community health center And this community health center, the other community health center was not having the same kind of financial problems. But once again, it was in that community health center system when we switched to EHRs. So it was a very dysfunctional EHR system. At one point in time, I counted there were over 20 clicks that I had to make to get a lab result into my inbox and send it to my nurse. Like 20 clicks, you can imagine primary care, how many times over and over that had to be happening, and just added.
I love that because I've similarly done these kind of passive aggressive, ways of explaining things. And I love this 20, it's costing me 20 clicks to do something that I could just write down for like
20 clicks. Yes.
Yeah,
20 clicks. Yeah. And I mean, the person that they had in charge of the EHR implementation, I think she was very overwhelmed. And I remember one point in time, I was trying to ask her to change the wording on one of the orders that we had to do because we were getting called from the radiology centers asking us what they were supposed to be doing. Because there was one of the codes was for an extracranial ultrasound, which is a carotid Doppler. But, apparently, it was confusing everybody, but it's just like something that would go in and you could just like change the words really easily, in terms of, I mean, I knew how to do it, but I couldn't do it because I wasn't the person that was supposed to be doing it. I didn't have authorization, but didn't want to even make changes like that, so it was kind of a struggle there, in terms of the computer system. And I just ended up working longer and longer hours. I had 36 patient contact hours a week, but was probably working more like 60-ish at least. Right.
I'm sure they paid you for all those extra hours.
Yeah, no. And I remember talking about wanting to cut back on my hours at one point in time. Right. Because I'm like, this is too many hours. But then I was going to be part-time and wouldn't qualify for the benefits that I needed. So I just felt really stuck, and I, got burned out. I still wanted to provide good care for the patients, but I really ended up feeling like I just couldn't make the system work. I was running behind. I didn't like being behind, but I thought it was more important to take care of the patient in front of me than to get them in and out the door,
So who did you were able to talk about these things? Did you talk about this with your husband? Did you have some confidants at work who?
Yeah, I talked to my husband about it. I was on the leadership team. I talked with the medical director about it. So I brought up, my concerns, my issues. I made some suggestions. I was having problems with charting, and I was like, well, hey, can I have a scribe? Could I have Google? Could we try the Google goggles? Could we try wave scheduling? And it was like no. And I'm like, okay, I basically just ended up getting really burned out and didn't feel like it wasn't sustainable. And I was trying to figure out, how to make the change or what to do differently, because I didn't know what to do. I thought it was me, right? Burnout wasn't a thing that people were talking about in the early mid 90s, not 90s, but
2000s, yeah.
The 2010s, right? Whatever year that is, right? People weren't talking about that back then, at least not people that I knew. So I thought it was just me. I didn't understand that I was getting burned out or whatever else was going on. But I know I needed to change.
Right. There were no internet discussion groups back then with other physicians.
Yeah.
That's what we have now.
No, don't remember any of that. Anyway, so I was reading a medical economics journal, and I read about this thing called direct primary care. And I Googled direct primary care near me and found a lady that was about an hour and a half away down in Louisville, Dr. Molly Rutherford, and she had opened a direct primary care practice. So I went down and visited her, saw her office, went to a conference with my husband, and came back and was like, hey, this is what I want to do. How are we going to make this work? And
I'm curious, how did that conversation? Did you just email her or pick up the phone and say, hey, I want to do the same thing. Can I shadow you? How did that?
I don't remember, this was like 6 or 7 years ago, but I either called her or emailed her, but she was, super helpful, very open to, come on down and shadow me, and I'll show you what my office is like. And that's one thing I really appreciate about the DPC community is there's a lot of helping each other that's going on. I think part of it comes from being a relatively newer practice style and not being quite so many of us, there. It's been a good community. But I still felt kind of stuck. It was hard to make a change. One of the things that helped me move towards making a change, though, is I also do addiction medicine. Yeah, I forgot to tell you about that hat. So I started doing that a year or two before I opened my DPC, and I was as an employee. And I had seen what people were able to do to change their lives, to improve their lives, and to get back on their feet. And with all these things against them, they were able to make things better, And I'm like, whoa, I don't have any of that stuff going on, I'm just talking about, opening a business. And even if the business has problems, I can go get another job as an employee someplace if that's what I want to do, So worst case scenario is I go back to doing what I'm doing now or do urgent care. You know what I'm saying? It's so that you kind of put things in a whole different perspective, and help me move forward. And I think that, and seeing that there were other people out there that were doing something different. I mean, that was super huge. I think if I had just read about it and hadn't gone to the conference and met these people who were doing things other than being an employed physician, right. I don't know. I that would have been so much harder for me to move forward. Because
you saw some people who were actually implementing it. It wasn't just a pipe dream. Yeah.
Exactly. It wasn't just a pipe dream. And everybody was happy. I mean, it was like the only medical conference I think I had been to at that point in time where people were actually happy about what they were doing. They were hopeful, and I think it's the whole being able to have some control over your practice or how you do things. I mean, yes, you've got the responsibility for it. You have to make payroll, there's certain things you have to, do, right? But to be able to decide, if you want to do something or not. That was one of the things that I had challenges with as far as an employed physician is I felt that I had all these responsibilities over the outcomes. I had all these boxes that I had to check, all these, criteria, but I didn't have any control over the process.
Right.
And so here I am, I'm like, okay, yeah, I agree. These are great ideas. We should do things. We should make sure that people have their, done. But if you only have 10 or 15 minutes to do it, and how is all that supposed to happen? I don't want to not educate them on their diabetes medicine so I can ask them if they have gotten all these other things done that aren't, anyways. So try to do PHQ cycles around that. But it never got things working well enough that I felt I could do what I wanted to with the patients. So.
As a doctor, I wasn't used to asking for help, especially when it came to subjects outside of medicine. But then I found physiciancoaches.com. In an instant, I found hundreds of experts to help me in all aspects of life. On areas I was afraid to ask. Dealing with burnout, starting a side gig, money management, even help with my marriage. And the best part? Nearly all experts are physicians themselves. After reading their profile and a quick chat, I knew I found the right mentor for me. At physiciancoaches.com, help from professional colleagues is just a click away.
I found that I read this somewhere, and it was a great description of why we were anxious or why we have anxiety. And it was simply a math equation. It was anxiety equals uncertainty plus powerlessness. Mm-hmm. So in the future, when you're an entrepreneur, you're always going to have uncertainty, but you have power. You empowered yourselves. And oftentimes as employees, we have both. We have this uncertainty and we feel powerlessness. Mm-hmm. And then for DPC, you found a way to empower yourself. Yeah. It's perfect.
Yeah. Yeah. And that's the empower. Yes. You hit it right on the nail. Perfect.
Yeah. So you go in, you go to this conference, you're surrounded by like-minded individuals. They seem really happy. You tell your husband, I want to do this. What was that timeline like? And when did you actually, like, how did you work on your business, work on your practice while still probably working, full-time schedule, I assume, in your FQHC?
How did I do that? Well, actually, I told them a little sooner than I was planning to.
Okay.
They were asking me to start up a new line of service for the company, doing addiction medicine services. And I was like, oh, I have to tell them, because I can't be responsible for starting a new line of services and then leaving. Right.
Sure.
Yeah. So it was kind of basically evenings and weekends. And it was hard to find the time to do some of the things that I was wanting to do. I did have a brief period of time where I wasn't open yet after I had left the employed position, but that was really because I kind of outed myself earlier than I planned to in terms of letting them know what was going on. So that was actually really helpful, though, because it is hard to make calls and find out about things during the day. It's hard to look at commercial properties that, if you're not getting home until 8 o'clock at night, how are you going to go look at the properties, Did
you have to, when you're looking for a place, did you want to make sure, or were there like non-compete clauses or anything like that? I know it's probably a different type.
No, they're totally were non-compete clauses. So my community health center that I was working at was over in Ohio. And that was part of the reasons why I came back over to Kentucky. Besides the fact that I lived here, there was a non-compete. So, which was really irritating because, I'm working at a community health center with patients who have Medicare, Medicaid, and aren't insured. And there are more patients needing those sorts of services, than there are places for people to get it, and just honestly, personally, I have a philosophical issue with people having non-competes. I understand as a business owner why you're concerned about losing your patients,
Right.
But from a patient perspective, people should have the right to follow their physicians. They should be able to, have their physicians tell them where they're going, some of my patients got their letters and some patients just had me disappear on them because not all my letters were sent out appropriately. And there wasn't anything I could do about that, but yeah, so I moved, basically I was starting from scratch, over here in Kentucky. And one of the big things I had to figure out though was, how was I going to finance everything? Because, I'm not independently wealthy. I'm the primary bread earner, so, a lot of those things were things that had kept me, stuck before. But it's one of those things that you have to, if you agree to move forward before you have all the details figured out, you're more likely to figure out the details, So initially, I increased the number of hours that I was doing the addiction medicine. So I was doing that twice a week, and in part to earn money, in part because I like it. I'm there 1 day a week still at this point in time. But also in the practice, once I was talking to more people about, the practice and what I wanted to do, and I found other things that I could do in addition to seeing the patients as I was trying to get more patients to come in. I could do physicals, for vets. I could do telemedicine. There was just all these other opportunities that I wasn't aware of.
Immigration physicals.
Oh yeah, I do those. I started doing those actually like right before the pandemic. So I didn't do this initially. I love doing immigration physicals. Those are actually one of my favorite things, just because I love meeting people from different backgrounds and different cultures. And you can see that looking back. I was an exchange student for a year, remember, back in 88. And I speak Spanish as a second language. So that's something that I like. And I also, having brought my husband through the immigration process, he came over on a fiance visa back in like 91. So I have some experience that way. But being able to do the immigration physicals for patients who speak Spanish in their native tongue, that's really nice, to be able to actually have a conversation with somebody as opposed to having them have to do everything through an interpreter. So yeah, it's fun.
Now, we have a number of people who listen to our podcast who want to set up their direct primary care practice. Mm-hmm. What are some like 2 or 3 things, advice that you can give them, lessons that you've learned after starting up your DPC?
Let's see. I would say network, both with other people who are doing direct primary care, with people in the community, so they can know you're there and know that your services are something that they want. And with other physicians who are doing things outside of employee medicine, both to learn of opportunities as well as just to get support, because it really helps mentally when you are working with and talking with and have support with other people who are also trying to do something different.
Now, when you signed up, did you, there's a bunch of DPC companies out there like MDVIP and some other things like that. Did you go with one of these companies or did you just do this on your own?
Yes. Yeah, no. MDVIP is really concierge more so than DPC. I was wanting to provide something that would be more accessible, coming out of the background of the community health centers, than MDVIP was. And yeah, no, I did it on my own. With, support and talking to friends and stuff, but it was a lot of learning, but I think being open to learning and, I think that's another big thing as far as learning, when you're starting your own business, realizing that if you make a mistake, you didn't kill anybody, and it's actually a good thing because that's how you learn. You know what I'm saying? And it's much easier to fix things some way in business. If you miss something on the lease that you should have found that you saw, well, the next time you see a lease, you're not going to miss it. You learn something, and don't beat yourself up about it. You just take it as a lesson and go on, Tell
us about your practice now. Is it a small practice, micro practice? How many hours are you kind of working on your business right now? And
yeah, so I have gone back and forth between being small practice and micro practice. I had an MA with me for about a year and a half, and then COVID. So then I had no MA for quite a while. Probably about a year and a half. And then I just hired her back in January. So, and I also have a virtual medical assistant that's with me 2 days, that answers phone 2 days a week. So I'm currently working in my DPC 4 days a week, combination of practice stuff, seeing patients, seeing direct primary care patients, doing immigration physicals, and then the business part of it. It's obviously a mixture of all of it. But I've really been able to, I think, grow a little bit more again these last couple of months since I've had Danielle back, because it's hard to answer the phone and schedule appointments when you are working with patients. So,
what surprised you? Is there anything surprised you after you launched your practice?
I'm trying to think one thing. There were lots of surprises.
I would assume so. We knew everything before it happened.
Yeah, no. Goodness sakes. Honestly, I can't think of one thing that was a surprise. It's just been an ongoing learning experience, which is good because, I like learning and trying new things. But I'm sorry, I can't think of one thing, Mike.
What in terms of a physician who wants to do this kind of practice, what type of skills do you think should they have if they want to take this on?
I think being willing to learn about the business aspect as well as the medical aspect. I think being not being as scared to make a change if something isn't working right. Being willing to put yourself out there in terms of talking with people about your practice, because you do have to go out and find patients, they're not just going to magically appear on your doorstep, and that takes word of mouth and networking. And it's different than when you're, if you're an insurance-based practice, people a lot of times would show up because your name was on their card, right. Or they look to see, who is the doctor that's close to them or that has the, the reviews. When you're starting from zero and you don't have an insurance feeding you patients, you have to get them from someplace. So you have to be willing to be a person to get out there and put yourself out there.
So how do you put yourselves out there? Are you doing community talks? Are you marketing online? What are some ways that you kind of market your practice?
Well, I've done a variety of things. I mean, COVID messed with some of them, but things that I have done, like over the last 5 to 6 years, I was in BNI at one point in time.
Sure.
I gave different health talks as far as at the library on different topics. I have had open houses. I have done cold calls and showed up at people's offices, like, hey, I want to meet you. Also, in the local physicians mom group. So putting that, out there. And then they kind of, I guess I'd like to say obvious, but maybe it isn't obvious because I don't know that it's obvious to me originally. Just having a website and, a Facebook page and that kind of stuff. I mean, I've done different forms of marketing, but really the word of mouth has gotten the biggest return.
That always is the best, right? Just kind of word of mouth. And and your name of your practice is Health Connections.
Health Connections Direct Primary Care.
Health Connections. Yeah. Okay, great. And we can put a link to that too on our show notes. So you're also a life coach. And yes. We were kind of joking. It's sounds like you don't have a lot going on right now. And you said, I'm going to, no. So tell me how that journey started, being a life coach.
Yeah. Well, you had brought up, is it not stressful, doing all those different things? And actually, I think coaching helps me with stress as opposed to adding stress. So it goes on the other side of the equation. But I was struggling with some things in my practice in terms of the ability to pivot and make changes and let myself do some of those things. And also having some issues in my relationship. I've been married for a long time now. I think anybody who's been married for 30 years would be lying if they didn't tell you they didn't have some things that they wanted to work on. And I was at the Leverage and Growth Summit back in 2020. And there was a physician on there and she was talking about what she was doing with coaching. And I was like, wow, sounds like this could be really helpful. And I signed up for her summer coaching program and just fell in love with coaching. And it was a really deep dive. It was at least 4 days a week, I was doing something related to coaching and either, one-on-one coaching or the group coaching or having a guest speaker coming on. It was pretty awesome. And then I went on and I did enrolled in the life coach school as far as for training to be a life coach. Mm-hmm. I had heard of coaching before in that I've been listening to Brooke's podcasts for a number of years. Mm-hmm. So, I kind of knew that it was out there. I had done self-coaching scholars at one point in time, but I had never been in a coaching program. I had never invested in myself that way. And it's definitely different when you are really investing in yourself and doing a deeper dive than when you're meeting with rotating people, for 20 minutes. It's a very different experience. So I signed up for the life coach school and that was kind of my start. So
tell us about your experience now. You've been doing this for about a year or a couple of years you've been doing physical coaching? Yeah,
so I've been certified for about a year now. So the certification, so I've been doing this for probably about a year and a half, as far as from the beginning of the coaching program, but in the business for about a year. So basically I have worked with different groups of people, but probably the group that I work with the most and who I probably relate with to the most is other physicians who are at a place where they want to do something different, but they're kind of feeling stuck, and they're trying to make decisions in terms of how to make things better for themselves.
Something that you didn't have when you were at the...
Yeah, no, I did not have a coach to talk to. It would have been so helpful. Because there are some things that, we can change internally about things, about the way we think about things, about whether things are stressful or not. And there are other things that just need to get changed in terms of the circumstance, mm-hmm. And just having somebody to talk through about what kind of a change that I wanted to make and work through some of what we call limiting beliefs. that would have been super helpful. And I think I would have been able to move faster, in terms of towards making a change in a way that was healthy and helpful for myself if I'd had somebody to work through those with. So limiting beliefs are beliefs that we have that we really believe are true, that hold us back from moving forward, so that's something that I work with folks on, and that can be really helpful.
So why do you think it just seems that, I was reading a thread on physician coaching, and, there's definitely people who have gotten benefit from coaching. It's still a majority, or maybe just my perception of docs who say, you know what, this is a bunch of baloney. I could just do it all on my own. What do you say to those folks who feel that coaching is a bunch of woo-woo and stuff? Because I'm sure you've seen this too.
Yeah, no, absolutely. I mean, I think there are a couple different groups of people you mentioned. There are people that think the whole thing is woo-woo and baloney, right? And those people, I'm like, well, they obviously have a closed mind against coaching. They haven't probably tried it themselves. And that's too bad. I would love to talk with them and, have them see what coaching is like if that's something that they're interested in. But then there's the other group that is like, well, I can just do it myself. And I think a lot more people are in that camp, and what I'd say to that is, yeah, you probably could do some of it yourself. Absolutely. I mean, that's why Brooke has the self-coaching scholars program is, there is a way to go and self-coach on things. You can look at the circumstance and look at the thoughts that you're having related to a circumstance and what feelings you're having related to those thoughts. And, and try to work through as far as the model yourself. Absolutely. And I do encourage people to do that, but it's really hard to see in your own mind the same way that somebody else can see in your mind. I know for myself, there have been lots of times where I have been stuck on something and I've been like I'll be trying to figure out, the model for myself. Like, okay, I'm trying to coach myself. Right. And I've been like hitting my head against the wall. And then, I'll have a session with my coach and it'll be like, something will just kind of click. Right. Or sometimes it's not even right then. I remember there was somebody that I had been coaching with, and I was like at a stoplight, and it was like we had this conversation like 2 or 3 weeks earlier, and all of a sudden I was like, oh, it's like something just shifted or clicked, and it was just really weird. It's like I felt a clunk, like mentally a clunk, and it was like sometimes when you see things like that, you can't unsee them. And the problem I had been talking with her about was something that I had been trying to work through for like 10 to 15 years. I talked to the counselor on, and I was still having the same issue. It was kind of it wasn't in the moment of the conversation with the coach that the difference that clunk happened, but it kind of got the wheels turning and like thinking things in a little different way. And with that, I was able to shift how I was thinking about something, and it really altered a relationship that I've been struggling with. So,
yeah, and I think too is because as physicians, we are usually the decision makers. We are usually the buck stops here. When our nurses come to us or MAs come to us, we have to make hundreds of decisions, if not thousands of decisions, weekly. And those same people who are kind of closed-minded with coaching, also, they don't really have a solution. They tend not to have a solution to their problems. And they're in the same situation that they were, 3 or 6 months ago.
Yeah.
Go ahead.
I was just thinking, one thing that I think can be a misperception sometimes is that people think that the coaches are going to tell them what to do.
Right.
And we don't tell people what to do, but we help them figure out what they want to do. It's a very different mindset in terms of being a coach versus being a physician. And as a physician, when I'm working with a patient, I have kind of certain things that, they should do this, they should do this, they should do this, whereas with a coach, it's more have that person in terms of what is right for them. And it's more me working with them to help them decide what is right for them and have them decide how to move forward and what is going to work best for them. I don't know if that makes sense.
It does.
But,
It does
yeah.
make perfect sense. Cynthia, this has been amazing. Lots of great information. Where can they go if they want to get more information about your practice, about your coaching practice? Where can they go to find out more?
Yeah. So my webpage for the coaching practice is www.coachcynthiamd.com. And I do have a freebie on there that they may be interested in, talking about overcoming burnout or some things that they can do, questions that they can ask themselves if they are looking at trying to make another change in their life to try to help them decide what direction they want to move forward.
All right. So we're going to leave that link here too. And again, if there are anybody who's interested in DPC, are you open to?
Absolutely.
Open for contact as well? Awesome.
Absolutely open for contact. I've definitely talked with folks about DPC in the past.
All right. Well, thank you so much. Any final words before we end the call today?
No, just thanks for having me on here. And I think the more people talk about other things that they can do, more people talk about things that other people are doing out there besides being an employed physician, I think that gives people hope. And it gives them ideas in terms of other directions that they may want to move forward themselves. So thanks for having me on here.
Yeah. And again, we're at a special time now where I go, just like Cynthia, I didn't see any of this stuff 10, 15 years ago. No. So now we're seeing doctors who are doing different things outside of their typical clinical employee practice, opening up their own practice, starting out their own online business, coaching business, what have you. So never feel that there's no opportunities out there, because the more we talk about it, the more we learn from each other. And as always, guys, don't get you stuck in a rut that you can't do anything. There are people out there like Cynthia who are willing to help. And again, thank you so much for being on the call today.
Thanks for having me.
And thanks, everybody. And as always, keep moving forward.